do our best to cover everything. So we're going to get started. So today we're going to cover our program history, volumes and outcomes, what the transplant evaluation actually means, and why it's important, and then some of the tests and appointments you may need, and kind of explain why. And then members of the transplant team and their roles, because you do meet a lot of people. And then common emotions and challenges, and then tips for staying organized. And then we'll talk a little bit about what happens after evaluation, but I am going to save, the bulk of what it means to be on the list for another presentation. And then we'll cover some questions and obviously provide you with some resources. So again, thank you all for joining today. I see we have a really great attendance, and I want to encourage everyone to ask questions. You can also, I believe, raise your hand in the webinar feature. So again, please feel free. So I'm just going to get started. I'm going to cover a little bit about our history because I do think it's quite interesting. We performed the first living related kidney transplant in New York State in 1963. And then in 1965, we performed the first deceased donor kidney transplant in New York. In 1998, we had the first hand-assisted laparoscopic donor nephrectomy. So that means the donor who got their kidney removed when we say nephrectomy. And then the first purely laparoscopic donor nephrectomy, so using minimally invasive surgical techniques to help donors' recovery time. And then in 2004, we performed the first islet transplant in New York tri-state area. And then excitingly, in 2008, we became the founding center of the National Kidney Registry, which we'll touch on what they are later in the presentation. But many of you may be familiar. They're an incredible paired exchange organization. And we were able to perform their first paired exchange transplant. There's a wonderful image down here, and be the founding center. So we're very proud of that. And then in 2013, we celebrated our first year as the largest living donor kidney transplant on the East Coast, third in the US, and then we celebrated our 50th anniversary. And then in 2014, we were the second largest living donor kidney program in the US. And in 2023, which was only 3 years ago, we celebrated our 60th anniversary and celebrated doing over 6,000 transplants. And then in 2024, excitingly, we had our highest volume of kidney transplants in the history of our program. So that was 320 kidney transplants. That was living and deceased donor combined. And now in this past year, we were the largest adult living donor kidney trans program in the tri-state area. And I do think in 2026, we are going to have another wonderful voluminous year and keep doing what we love and helping patients. So these are some of our volumes that you can see over the past, from 2014 to 2025 onward. You can see at one point we had more living donor transplants than deceased donor transplants. And then when we had the allocation change in 2021, we had a rapid boom of deceased donor transplants. And we'll talk about that allocation change in a few slides. But as you can see, we've been quite busy. And this is just our infographic sharing our accolades of last year. And again, we are very proud that we have been a national leader in living donor kidney transplantation for more than 20 years. And then these are our outcomes, which are very important. I want everyone to know where they can view the outcomes of not only our center, but other centers. It's on the srtr.org, which is the scientific registry of transplant recipients. You can also find more information, but what is interesting about this is it's comparing our program versus the United States population, and we can see our patient survival rates and the graft survival rates. So when we say graft survival, we're talking about the kidney. So as you can see, our outcomes are even better than the national outcomes for majority of the categories. So we are very proud of these outcomes and our graft survival. Okay, so to the nuts and bolts of today's presentation, what is the transplant evaluation and why is it so important? So, the transplant evaluation is a comprehensive medical, emotional, and social assessment to determine whether a transplant is the safest and best treatment for you. Overall, it helps our team evaluate your health, assessing your function, identifying risks or barriers, and it helps us ensure that patients are physically and emotionally prepared. Because believe it or not, while the transplant eval feels like such a large undertaking, because it is, it's just the beginning of the work because the work really does also come when you get that transplant and you're taking care of that transplant. So we want to ensure that patients are always going to thrive post-transplant. And building that plan for long-term success is hugely important. And just some important reminders, the evaluation test is not a pass-fail. It's a really thorough process to make sure our team can support you and to make sure, again, you're going to thrive post-transplant. We don't want people to decompensate. We want transplantation to be a life-changing, a life-enhancing event. So sometimes, unfortunately, there are people who come forward for evaluation and transplantation may not benefit them and they may not do well. So that's why our team does such a thorough, rigorous evaluation. Um, and again, all of these things, there are tests and evaluation required things that we must do to put you on the waiting list. Some of those include blood tests, diagnostic tests, which I'll get into, the psychosocial evaluation, and the evaluation by the transplant team, which I will explain all the members. So initially, the blood tests are done to gather information that will help determine how urgent it is that you're placed on the transplant list. We measure and look at the patient's GFR 20 or less is an eligibility criteria. We also work very closely with the patient's referring nephrologist to ensure, this is the right time. Most likely patients who have been referred to our program have been referred by either their nephrologist or their dialysis center, or they're shopping around and doing their own self-referral. But we do obviously look at those lab values. And then we also want to make sure that you're receiving a good match, which is a word, many people speak about. Some of the other tests you may be familiar with since they evaluate your kidney and other organs, but I am going to go through that. So blood chemistries that may include the creatinine, which we know is the big number we're looking at when we're determining kidney function, electrolytes, cholesterol and liver function tests. We do evaluate all of these. We also look at some of the clotting elements within the blood to just ensure that patients won't have any issues once they have that transplant. And other blood tests will help improve the chances that the donor organ will not be rejected. So, um, this might be a very, very big review for most people, but just because if you're new to this process, I do want to explain blood type. We check the patient's blood type not one time, but twice, and it has to be on a different day, different date, because we want to ensure that that is accurate. So each person has a specific blood type. You're either an A, and a B, an AB, or an O. You may not know your blood type when you come to our program, and that's absolutely fine. We will test it, and some people just don't know their blood type unless they've needed a blood transfusion or, had a child. They didn't know until then. So when you do, if you do need a blood transfusion ever in your life, the blood received must be compatible with your own or a reaction will occur. A similar reaction can occur if a donor organ or a different blood type is transplanted into your body. So we are very cognizant and there are multiple checks. So a person with blood type A can receive a kidney from an A or an O. A person with a B can receive a kidney from a B or an O. A person with the blood type AB, also called the universal recipient, can receive from an A, B, AB, or O. So it's kind of the best blood type to have. And then an O can only receive from an O. So O's are called the universal donor. So an O can give to anyone, but they can only receive from an O themselves. So there are cases, though, where transplants between a donor and recipient who have different blood types may occur by using medications, or if we subtype and check your titers, for example, A2 can receive, or blood type B can receive A2 organs. That would be something you speak to your transplant coordinator about and you're consented for, but that can be an ABO incompatible transplantation, and that does happen sometimes. Um, Next is something called the human leukocyte antigen, the HLA, and the PRA. Those are um, acronyms you may hear throughout your evaluation. And this is kind of when we talk about the matching. So the HLA test, these tests help us find the best match for a transplant. We check your blood for antibodies, which are proteins that your immune system make. Your body can also make antibodies to things like blood transfusions, infections, or transplants, which is why if you're past the process and we've ever called you for a transplant, we ask in the last, day or so, have you had a blood transfusion? Have you had an infection? We want to make sure that you're not having a new surge in those antibodies. Pregnant women can also develop antibodies. And sometimes these antibodies, if they're very high, it can make it harder for your body to accept the new organ. So we do, of course, give patients immunosuppressants when they get the transplant. I'm not going to talk about medication today, but we're going to have a whole presentation on that. But they help lower your immune system response and protect your new organ. So these are things that we would test during your evaluation. And with that information, it will help us when we're putting you on the waiting list. Your coordinator will tell you if you're highly sensitized, meaning you have a high PRA. You may be harder to place. It may be harder to find you a kidney, but um, don't sweat about it right now. This is just some overall information. So some of the medical tests that may be required for the eval are a chest x-ray or an EKG or an echocardiogram. An EKG, we look at the rhythm of your heart. An echocardiogram, we look at the valves and how your heart is pumping. Um, it's very important. Many of you may have already had an EKG or echocardiogram. You can bring those test results with you, but most likely you'll be getting one of those very, frequently closer if you're higher on the list, maybe every year. And we do want to make sure your heart is functioning well because you're going to undergo a surgery. Stress test to make sure there's no clots within your heart. We want to ensure that your heart is in good shape. A CT scan or ultrasound is critical. We do a CT scan on every patient because the surgeons want to see your anatomy. They want to look at those vessels. They want to make sure that they have a place to put the kidney. Additionally, we want to ensure that you do not have any issues. And so a scan will help us make sure everything is clear. Colonoscopy, every patient needs one of those if they meet the age criteria. A mammogram, pap smear, those are well care elements that you hopefully have had or will have within your eval. Um, those are all really just important things that people should have in general to screen themselves for cancer. And then dental clearance can be required sometimes by patient's insurance. It's not always a requirement for us, but I just put it on there because sometimes insurance companies require it. And then there's infectious disease screening that we do as well, part of the eval. Um, so you may say, whoa, 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 that's a lot of testing and that's a lot to sign up for in the appointments. And so many patients can feel information overload, anxiety, fear. Having a surgery is scary. And they may feel frustrated with the appointments because there are lots of appointments. And if you miss an appointment, you have to reschedule and they can take a while. That's part of the process. And that's why if you ever do get an appointment, you know, it's really important that you make those appointments. I will say if we have patients that have a track record of like multiple no-shows on their appointments, that is a little concerning for our team. Um, there can be fatigue from testing. There can be financial concerns, which is very real. And that's why we do have financial coordinators you meet with. And then you can be worrying about the future. It is normal to feel overwhelmed, but we are here to guide you step by step. So the team, let's just talk about the basics. You're going to meet with the team as you go through the evaluation process. Your surgeons, the transplant surgeons, they specialize in the surgery, um, and they will be very involved in your case, including your immunosuppression regimen. Then you'll meet with the transplant nephrologist again. They are specialized in disorders of the kidneys and they will help manage your condition before and after the surgery. You are followed closely by our transplant team, from 1 to 3 years after the transplant. Um, but you then also will stay in communication with your current nephrologist as well. We always send our patients back, but you are followed heavily by our transplant nephrologist because we want to ensure that you thrive. Here's a great photo of our surgical and transplant nephrology team. Um, and you may recognize some of these faces. So there are other specialized physicians that you may have to see during your eval. That is something I really want to make clear that it's not just transplant nephrology and the surgeons. Um, as you would imagine, when we are getting an echocardiogram, EKG, stress test, we need you to see a cardiologist. Um, Most of our patients require cardiac clearance prior to surgery, so that is why we would have that visit. Um, some patients need to get endocrinology clearance. Those are endocrinologists, they specialize in diabetes or management of other issues such as like thyroid disorders. Um, we also may have to send a patient to a hematologist, and that's a doctor who specializes in the disorders of blood, bleeding or clots. If we bring you in for evaluation and we suspect any history of clotting, we will run a panel. And if those labs come back, concerning, we'll probably send you for hematology clearance. Hepatologist, that's a liver doctor. And so if we need you to see a hepatologist for any sort of clearance, we may have that. And then infectious disease specialists, we actually have like a transplant infectious disease specialist that we work very closely with, especially for our patients that are HIV positive. We do have HIV positive patients who are successfully transplanted. And we work very closely with our infectious disease team. And then our psychiatrist. So our patients may have to see psychiatry. That will be a decision usually made by our social work team. And we have a great, transplant psychologist who is there to offer recommendations should, he deem it necessary. So those are some of the doctors you may have to see. Then the transplant coordinators are basically your care manager for your transplant. They are the health professionals. Most of us are nurses. We have a transplant coordinator who's a PA. They are going to organize your exams, your testing. You're going to keep in contact with them. They're going to put you on the waiting list. They're going to maintain your status on the waiting list. You will be assigned a coordinator that you will hopefully stick with through the entirety of your transplant eval and waiting time and the whole process. And I like to say again, the best thing you can do is when you come in for eval, put that coordinator's phone number in your cell phone, write down that email, and stay in constant communication with your coordinator. Um, that is going to be your biggest, if that's the biggest takeaway you take from this presentation is contact your coordinator. And then we do have physician assistants that we work with who are paired with the surgeons or the nephrologists, and they manage the care of the transplant candidates in both the inpatient and post-transplant settings. And then we also have a nutritionist who helps meet with your nutritional needs before and after transplant. especially if you're a patient who is told that you need to lose a little bit of weight prior to transplant, or you may have concerns about your diet, electrolytes. I know a lot of dialysis centers do have nutritionists, but our nutritionist, his name is Mike. He specializes in transplant. So he's fantastic. And then we have our social workers who are also so critical and fantastic. They will help you, your family members, and the support person of your choosing, work through some of the issues. And they will also evaluate you very thoroughly to ensure if there's concerns, if there's risks. A patient cannot be put on the list without social work's approval. So they are monumental. Stay in contact with your social workers as well, especially if you're like having trouble with lodging, transport, finances. They're monumental. And then we have clinical pharmacists who assist our team in your medication regimen, and they provide a lot of education, especially inpatient, on the meds you're going to be taking once you have the transplant, the immunosuppression meds. People leave with, a pretty large med carrying kit, and they get a lot of that education while they're there, but they're always available for you to assist. We have a very thorough pharmaceutical presentation that we can share with you, led by our clinical pharmacist. And then another really important member of our team is our financial coordinators. They work with you and your insurance company to evaluate your ability to have the transplant and manage your medication costs, because transplant is expensive, and we need to ensure that you're covered, and they are a great resource for you. So you have that visit initially, even prior to a lot of this workup. And then lastly, our clinical research and transplant quality team, they are here to educate you on any opportunities for research studies available. Meredith obviously is the leader of that team, and they also monitor to ensure that the transplant outcomes and everything is compliant within the regulatory requirements. So they are hugely important to our team. So that is the transplant team. And now we're going to kind of pivot into the importance of support systems when you come in for your evaluation. Your team is going to ask you about your family and caregiver support. I know Laura is definitely going to ask that. We need to make sure that you have safe transportation, reliable transportation to get to appointments. We also need to make sure that you're going to be able to take your medications and have a history of compliance. We want to see that you went to your appointments. You're not going to be penalized if you missed a couple appointments because you were sick, and life happens, but we want to make sure you don't have a history of like missing very important appointments like your dialysis treatment, or missing medication that is critical to your well-being. We also want to make sure you have safe housing and the emotional support to get through this transplant, because it's a very emotional process. And you need a caregiver to go through the transplant process. That is a requirement. And a strong support system can make or break the recovery and long-term success of a patient. So um, that is something I really wanted to emphasize. And I just wanted to share some tips to stay organized when you come for the eval. It may not be something everyone can do, but keeping a folder or even a binder, but a folder of your appointments. When you come for the appointment, you should be getting an after visit summary or a letter with all of the things you need to complete. Um, Use a calendar for appointments. I know that's kind of a no-brainer, but myself personally, I have a written calendar. I have a calendar of appointments in my phone. And then I have another calendar because it's that hard to sometimes make those appointments. Um, And sometimes if you don't get a text reminder from the MyChart app, you may not know that you have an appointment. So I didn't add this, but always, make sure you're signed up for the MyChart portal because they send you a lot of reminders. Maintain an updated medication list and track your completed testing. If you know you did an exam and our team is saying, well, we don't have record of that, we, we'll just be kind of in a standstill. So if you have a good organized process of keeping track of your records, that can make the transplant evaluation move a lot quicker. Um, Save all the important contact information, write down questions before visits, and these small organizational habits can reduce stress. Communication is also key. Always let your coordinator know if anything changes with your health. Um, we want to know if you, again, were admitted to the hospital. We want to know if you've moved. We want to know if you're traveling for 3 weeks. I know these sound like silly things. Maybe the traveling doesn't sound that relevant, but these are important things for us. Tell us if you're not feeling well. Like, let us know. We want to know these things. Um, so what happens if you're approved? Or what happens after evaluation is complete? Um, if the transplant team, we feel that you're an acceptable candidate, there will be a selection meeting. And when we say selection meeting, it just means there's a committee of the whole entire team. They talk about your case and you get approved. Um, and once you are approved, you will be placed on the United Network for Organ Sharing UNOS waiting list, which we'll talk about in a few minutes. You can be placed on a list as active or inactive. There are things that you need to know about this. If you are placed on the list as active, you are eligible for organ offers. If you are inactive, it still means you're on the list, but you will not be getting organ offers. You will be accruing waiting time, and gaining that time is so critical. But it is really important to know that you may need ongoing follow-up appointments once you're on the list, annual reevaluations. Some patients we're requiring it annually or every 2 years. Your transplant coordinator will let you know. You might need to do updated screenings and you need to keep some of your testing updated. So just because you got listed, 4 years ago doesn't mean it's like hands wiped where we don't have to contact the transplant team. No, you're going to have to keep your testing updated because if so much time has passed, we don't want you to have decompensated and maybe be at risk for issues post-transplant. So those are really important things. And then staying healthy while waiting, preparing for the call. These are all things that you will be educated on once you are activated. And we can talk about that in a little bit, but I didn't want it to be too much about preparing for that call yet because we want to get you through the eval process first. Um, I wouldn't it wouldn't be a presentation if I wasn't able to talk about living donation. So there are two types of options for patients. You can come to our center with a living donor. You can come to our center without a living donor and try and find a living donor. You can also be eligible for deceased donor kidneys. But living donation is the best option for patients who need a transplant. They function more quickly and efficiently. They survive longer than deceased donor organs. All potential donors receive their own independent evaluation process. That is very important to know. But the big takeaways are there are advantages to living donor transplant. No waiting time, meaning you're not waiting potentially a couple years for that deceased donor kidney. You're able to schedule your surgery with the optimization of your health. And if you can preempt the need for dialysis, that's even better. We know that patients who are not on dialysis, who get their transplant prior to, have greater outcomes. Kidneys from living donors last longer and they begin to function when the recipient is on the operating table. So, living donation again is the best option for patients. If you again can find a living donor before you come in for eval, fantastic. That will be one of the first questions you're asked on our registration form. But come in, get evaluated, complete your evaluation, and while you're getting your testing done, start looking for a living donor. Start having those conversations. We have a lot of resources. I particularly meet with patients to discuss how there are strategies and ways you might be able to try and find a living donor. We have our microsite program. So there are a lot of support options in place. Um, as I mentioned earlier, we are the founding center of the National Kidney Registry. And the wonderful thing about the Kidney Registry is that it gave us a solution for people who were incompatible. So, 1 in 3 people who come forward with a living donor, they are not able to give to one another directly because they might not be blood type compatible. So the National Kidney Registry was created to expand those options, expand the living donor pool, um, and we can have patients basically find better compatible matches and better quality matches using the National Kidney Registry. They have facilitated more than almost 10,000 living donor transplants, and they are the leaders in the paired exchange. They've revolutionized the field. Um, Opportunities within living donation, as I mentioned, the microsite, there is opportunities for advanced donation. So um, perhaps someone comes forward with a donor and the donor can only go during this particular amount of time. Maybe in the summer, the recipient isn't ready. The donor donates in advance. Or a grandparent wants to donate to a younger child, they won't donate their kidney and give the child a voucher should they ever need a transplant later in life. Um, the microsite program, here's a great example. This is Michael Strong. His site did really well. You can see here the option to see if you're qualified to donate. It's a free site you can make. There's pictures, you can personalize it, why you need a kidney, how you can help. Then it links all the donor support protections at the bottom. There's donor education. Everyone who does not have a donor should make a microsite. And then there's other opportunities for Kidney for Life, which is basically precision compatibility for lasting kidney health. And so, again, if you have a living donor, you will discuss more with the living donor team about these options. The donor shield and donor innovations and care that can be provided. This is again donor focused, less recipient, but there's lost wages and reimbursement for our donors. There's travel and dependent care. There's remote donation for people who want to donate their kidney to someone, but they live in California and they just want to stay in California and they can't travel. So we have remote donation. They can do local testing and workup. So never rule out a donor if you're like, oh, they live in California. There's just no way they can help me. We do transplants, remote donation. Donors often want to come to our center because we are nationally known. Um, and so there are all of these protections put into place for our donors. Deceased donation, again, if you do not have a living donor and you're put on the waiting list and you are waiting for a deceased donor, it is important to know that the new allocation that went into effect in March 2021, we are now receiving organ offers from a 250-mile radius surrounding our center. We've reduced our waiting times, which were very high historically, about 8 to 10 years for a kidney. We're telling patients on average about 3 years, depending on the blood type. Um, and it's just important to see this map because you can see we're capturing organ offers that are considered local all the way down to Maryland and up into New Hampshire. It does make the element of multi-listing something to talk about. So now you can multi-list. You can list in other states, right? But now you can list in New York State and list in other centers. But it's not that beneficial to list within the same geographic region. So you can obviously make that decision on your own, but when you're coming in for evaluation, it is important to know that this is geographically, this allocation is geographically driven. Um, and so I just wanted to make that an important note. We also just, again, to clarify, we also get national offers. So we got kidney offers from California, Ohio, not within just this radius, but those are considered local. Okay, so now just to pivot to patient education and support, you're obviously here today entering our virtual insights on kidney transplantation. Today's topic again was navigating the eval process. Next month, we're going to talk more about kidney paired exchange, which you may be interested to learn more about if you especially have a living donor. Then we're going to talk about managing those medications after transplant. And then August 20th, we'll talk about life after kidney transplant, led a lot by our post team. And then September 24th, we'll touch with Laura and Mel on the mental health and supporting the transplant recipients element to transplantation. And then in October, we'll talk about living donor kidney transplants some more and the stories of generosity. In the meantime, if you are not signed up for our support group and you are looking for a very warm, welcoming group of people who are in the eval process, waiting for a kidney, newly transplanted, couple years out. It is everyone. Please join. It is a great group, and we all learned so much from one another every session. It's one of the best things we do here at our program, I think, because it's so nice to see patients supporting one another. Um, and then just to end it with our wonderful patient groups. So, at our program, we are really proud of these people and the excellent patients, and we're very proud of our survival and organ, our transplant rates and our volume. So, um, again, thank you so much for attending today's presentation on navigating the transplant evaluation. Some key takeaways. The evaluation process is thorough for safety reasons. Every patient journey is unique. Organization and communication help. Emotional support is important. And your transplant team is there to help guide you. I put my email there if you have any questions about where you are in the process, what you need to do, if you're feeling stuck, if you just need help. Please send me an email and I will either direct your email to your coordinator or help you myself. Um, yeah, and now thank you. Yeah, now we can stop and allow time for some questions because yeah, we're right on schedule. Alrighty. And if um, okay, we have a raised hand. Great. I'm gonna allow this person to talk.
Hi. Hi. What's the age limit for the colonoscopy?
Age limit or age
Uh,
requirement?
I'm sorry, age requirement.
So, colonoscopy, it's funny you say this. Colonoscopy guidelines, I actually was just reading about this morning because the American Cancer Society updated the guidelines, but um, it is beginning at 45 for average risk individuals. That's the regular screening. But patients who have a family history should get screened earlier. And the newer guidelines I think I just learned about is there's a new blood test, a new diagnostic, or there's a blood test they can do to essentially assess if there's like tumor DNA in the bloodstream. But the colonoscopy is the first line of re recommendation. Did that help? 45
Uh,
enough?
yes and no. I'm way over 45. So,
Okay.
and
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 you've
I've
never
had
had one?
no, I have had one, and
Oh, okay.
I'm due for one this year. So I'm wondering, should I do that sooner rather than later if I'm waitlisted?
Well, so actually, a good way to check to see when you're due is at the bottom of the report and the colonoscopy screening that you had. It usually will give the guidelines for how often you should repeat
No,
it?
it does, and I'm due this year. So
Oh,
what
okay.
I'm saying is, if what my situation is, I'm waitlisted, but I'm inactive, so I'm trying to
Got
be
it.
react. I got to be reactivated.
Got
So
it.
as part of the reactivation, should I be scheduling my colonoscopy sooner rather than later? That's the
Yes.
question.
That's
Okay.
very proactive. I apologize. I
Yeah. Okay.
misunderstood. Yes.
Okay.
Okay. Yes, schedule it because those appointments can take a while to yeah,
Yeah. Yeah.
but it's
Okay.
wonderful to take that on because usually you gotta schedule that
Yeah, no,
colonoscopy.
yeah.
Yeah.
And then the other thing is about the dentist.
Uh-huh.
If usually, do I have to go to my insurance company to ask them if that's a requirement?
No,
Or who tells me I need that or I don't need that? The coordinator? Because finance. Okay.
Finance
All
will
right.
let you know. It's
Okay.
honestly very rare that I see it, quite honestly, but I have seen, that's why I put it there. I've seen it for like a couple insurances. They require this dental clearance, but most don't. So unless you're told you need it, again, you should be given very clear instructions on what you need. Don't worry about it.
Yeah, that was not one of the things she told
Okay,
me I needed. So I
great.
just wanted to know, is that now a new thing that
No, I almost shouldn't have added it because I didn't want to confuse someone,
No,
but I
well,
see it.
no, I'm glad you did because when I
Yeah.
first started the entire evaluation process, they asked me if I had a dentist, and I'm like, what does
Mm,
that have to do with anything? So now
right.
I get it. Now I
Right.
understand the question. Yeah, okay.
Right. Yeah. That dental health is all, infection risk. It's all connected. So that is, I mean,
I
I
see.
would always suggest people stick to their, annual it's Q6 month every 6 month cleanings, just
Yeah,
ensure.
yeah, I'm fine with that. I just
Okay.
wanted to know, I have a
Yeah.
hematologist who has been sending in a letter saying that I'm okay for surgery. So I was
Great.
wondering, do I now have to go to the dentist to
No,
ask
no,
him the
no.
same
No.
question?
No,
Yeah,
no, no.
okay.
You sound like you're very, very organized.
Yeah.
So
Oh, well, thanks, but boy, it's a lot.
I know it's a
Yeah.
lot. And,
Yeah.
again, I think that's why this is such an important webinar, just to emphasize the why behind it and,
Yeah.
but also just to keep people encouraged to get through it because it will be worth it. Actually, one thing I did want to show everyone before we end, because I have 47 minutes, was
Mhm.
a patient story. And I apologize. That was something I wanted to do, and I'm going to stop sharing my screen. We're going to pop over to YouTube, and I'm going to share you with you guys a really wonderful patient story of mine. Um, and that was ready, share. Okay. So this, okay.
My name is Wayne Temple. The date of my transplant was April 26, 2019. My wife is from England, and it was her birthday on the 25th of April. And that's the day I got the call, and I went in for the operation for her birthday. That was a nice birthday present. All she's known is me going to dialysis. She's never, we've never been together where I didn't have to go to dialysis. So this is a real life-changing thing for me. My biggest fear was that I'd never get one. After 8 years, I was like, I probably never get one. But I just want everybody to know you never give up hope because eventually it comes around. Never give up hope. You know, go for your evaluations every year and just be ready because, like I said, it can come at any time and when you least expect it. So you really, really just stay vigilant and follow your doctor's orders. It's really changed a lot because now I'm able to travel. Um, I'm able to do things that I wasn't able to do. I can eat things that I wasn't able to eat before. And like I said, for 11 years, I've been restricted. And now it's almost like I'm free again. Staff is conscientious. They're very sensitive to your needs. And That's one of the things that fear about coming to hospitals, that, you know, people aren't attentive to what you need. I find it the total opposite here. Everybody's friendly, courteous, and very attentive to the needs of the patient. The staff is great, PAs are great, nurses, the doctors. I, for a hospital, this is the best hospital I've ever been in. I've been in a few. This is definitely a top-notch hospital, and I would recommend it to anyone.
That is a very sweet patient. So I just love that
My name's Jay Decker, and
because
Decker.
I think we have another one going. He just talked about not giving up hope and sticking with the process and sticking with the transplanted vow. Um, so again, wanted to open this up. If anyone has any other questions, raise your hand, speak freely, or just email me if you feel more comfortable. And I want to thank everyone for taking the time to be here today.
Well, thank you for having it.
Yeah, of course. And if you also have other topics you would like us to cover, please again share. We will do our best. We have a ton of resources on our YouTube channel and our website, and we probably have a webinar that has been covered on said topic, but we're always, you know, looking to provide what the patients are interested in. So, okay. I'm going to give everyone
Yeah.
10 minutes of their day back. Alrighty.
Okay, thank you.
Thank you guys. Really appreciate it.
Thank you.
Bye.
Bye.
Bye.